60 people could soon be monitored for Ebola symptoms in Minnesota. That is double the number the state said it had been watching just last week. The health department today said all of the people are travelers who have recently arrived from West Africa. Susan Elizabeth Littlefield is here right now with why some travelers are actually glad to know that they're on that list. Susan Elizabeth.
Yes, Amelia, they were actually thrilled. That's according to the Department of Health. Travelers weren't sure if they needed to stay away from their families, their kids. Now they know they don't have to quarantine themselves and that someone else is going to check in on them daily.
Wake up, oh, Mama Liberia.
These Brooklyn Center friends have been raising their voices to raise money for their homeland.
Mama Liberia.
Late this month, B.B. Wright, who is now a Minnesota pastor, will carry the money in person back to Liberia.
So we can be able to give to those that are in need, even those who lost their people during the Ebola crisis.
She's already gotten a series of shots, but knows when she gets back in early December, she'll have some work to do.
I'll take my own temperature.
She will actually be held accountable to do that twice a day by the State Department of Health.
And we contact them to check on their status every single day. If they have any fever or any change in symptoms, they have a 24/7 phone number that they can call. So they're instructed to call us, and then we will follow up with them and work with them on that situation.
As part of CDC protocol, anyone entering checkpoint airports in the U.S. from Liberia, Sierra Leone, or Guinea must be monitored daily for 21 straight days. Right now, the Minnesotans on the monitoring list have not been in direct contact with infected people and didn't have fevers upon arrival.
Right now, all 48 of the individuals that we're monitoring fall into the low risk category.
Wright will soon be on the list, part of the new welcome home process.
So as long as she does not have direct contact with Ebola patients while she's in Liberia, she will also fall into that low risk category. However, any healthcare workers who travel overseas there, they may come back and have some stricter supervision here.
And Susan Elizabeth, how's the health department tracking these travelers?
Well, the CDC checks people at airports, then they send a list to the state. The health department says, though, it's sometimes hard to track people down. They actually now have a disease investigator, as they call it, who tries to find those travelers in person. In fact, in addition to the 48 people who are being monitored now, the health department is currently looking for 12 more travelers.
All right, Susan Elizabeth, thank you. And stay with WCCO 4 News for continued coverage of how this virus is handled in the United States.